Welcome to A to Z of Nursing. Here we have another video on the topic, the nursing process. Let's dive into the video. In the year 1958, Ida Jane Orlando began developing the nursing process, still evident in nursing care today. According to Orlando's theory, the patient's behavior sets the nursing process in motion. Through the nurse's knowledge to analyze and diagnose the behavior to determine the patient's needs. Application of the fundamental principles of critical thinking, client-centered approaches to treatment, goal-oriented tasks, evidence-based practice EBP recommendations, nursing intuition. The nursing process functions as a systemic guide to client-centered care with 5 subsequent steps. They are assessment, diagnosis, planning, implementation, and evaluation. What is nursing process? The nursing process is defined as a systemic, rational method of planning that guides all nursing actions in delivering holistic and patient-focused care. The nursing process is a form of scientific reasoning and requires the nurse's critical thinking to provide the best care possible to the client. What is the purpose of the nursing process? Number 1. To identify the client's health status and actual or potential healthcare problems or needs. Number 2. To establish plans to meet the identified needs. Number 3. To deliver specific nursing interventions to meet those needs. Number 4. To apply the best available caregiving evidence and promote human functions and responses to health and illness. Number 5. To promote nurses against legal problems related to nursing care when the standards of the nursing process are followed correctly. Number 6. To help the nurse perform in a systematically organized way their practice. Number 7. To establish a database about the client's health status, health concerns, response to illness, and the ability to manage healthcare needs. The following are the unique characteristics of the nursing process. Number 1. Patient-centered. The unique approach of the nursing process requires care respectful of and responsive to the individual patient's needs, preferences, and values. The nurse functions as a patient advocate by keeping the patient's right to practice informed decision making and maintaining the patient-centered engagement in healthcare setting. Number 2. Interpersonal. The nursing process provides the basis for the therapeutic process in which the nurse and the patient respect each other as individuals, both of them learning and growing due to their interaction. It involves the interaction between the nurse and the patient with a common goal. Number 3. Collaborative. The nursing process functions effectively in nursing and interprofessional teams, promoting open communication, mutual respect, and shared decision making to achieve quality patient care. Number 4. Dynamic and cyclical. The nursing process is a dynamic, cyclical process in which each phase interacts with and is influenced by the other phases. Number 5. It requires critical thinking. The use of the nursing process requires critical thinking, which is a vital skill required for nurses in identifying client problems and implementing interventions to promote effective care outcomes. The 5 steps of the nursing process. ADPIE. The acronym ADPIE is an easy way to remember the components of the nursing process. Nurses need to learn how to apply the process step by step. However, a critical thinking develops through experience. They learn how to move back and forth among the steps of the nursing process. Assessment, diagnosis, planning, implementation, evaluation. The steps of the nursing process are not separate entities but overlapping, continuing sub-processes. Apart from understanding nursing diagnosis and their definitions, the nurse promotes awareness of defining characteristics and behaviors of the diagnosis, related factors to the selected nursing diagnosis, and the intervention suited for the treatment of the diagnosis. Here we see a diagrammatic representation of the overlapping nursing process step by step, which shows that the assessment includes collecting the data, organization of the data, and validation of the data, which is followed by the diagnosis, which is to analyze the data, identify the health problems, risks, and strength, formulating the diagnostic statements, which is again followed by planning, which is to prioritize the problems and diagnosis, formulating the goals or the desired outcomes, selecting the nursing interventions, and writing the nursing interventions. The implementations, which is overlapping the planning and evaluation, are to reassess the patient, determine the nurse's need for assistance, implementing the nursing interventions, supervising the delegated care, and documentation of the nursing activities. The final step evaluation is to collect the data related to the outcomes, comparing the data with the outcomes, relating the nursing actions to patient goals or the outcomes, drawing conclusions about the problem status, and to decide whether to continue, modify, or terminate the patient's care plan. Thus, the steps of the nursing process are not the separate entities but overlapping, which is the continuing sub-processes. Thanks for watching. If the contents of this video are informative, like the video, share this with your friends and colleagues, subscribe the channel for more videos. Thank you.